In this section, we're going to talk about nursing home care. Is it a last resort, something that everyone wants to avoid, or is it sometimes the best option or the only option? So first we'll talk about why doesn't anyone want to live in a nursing home? And maybe you think, well, that's stupid. Everyone knows. Well, there are some very specific problems with nursing homes. Number one, they have a bad reputation. There is a documented history of homes that were abusive. There continue to be some incidents of abuse in nursing homes, although the state health departments are really doing a much better job of supervising nursing homes. And residents of nursing homes have rights in every state, and families do have the right to file complaints and get their needs addressed. But you do have to be careful to choose one that has a better reputation and offers good care. There's great stigma in placing a family member in a nursing home. A lot of people look askance and say, oh, you can't take care of them at home. When a person needs 24-hour care and they need 24-hour skilled care, they need a nurse, they have physical illnesses that require more care than a home health aide can give, than family can give, a nursing home may be the only option. And if the family can't afford to pay a home health aide to help them out, and insurance of Medicare, Medicaid, they're not going to cover 24-hour home care. When there's a need for 24-hour home care plus nursing, the idea is they want you in a nursing home, and it may be the only option at that point. But there remains a lot of stigma. For the person themselves, you don't want to be living in a facility, because when you live in a facility, you lose a sense of personal control. You lose your independence. You're eating when meals are served. You're taking a bath when the aide can help you with that, right? You lose a lot of your sense of control over your own life and your sense of independence. You're living in a facility, right? So there's a loss of privacy. There are people walking around all the time. And it is difficult to be surrounded by illness, by a lot of very, very sick people. So it can be stressful and depressing to live in a nursing home. But again, choosing the right one can make that better. So we talked about improvements in nursing home care, and one of those is the establishment of residence rights. And every state has a residence bill of rights that has to be posted in the home. And what are some of those rights? You have the right to privacy. Yes, you live in a facility. Yes, you live among other people, but you have the right to close your door, and staff should knock before they come in. You have the right to refuse care. Sometimes you have the right to make stupid decisions and refuse something that might be good for you, but nonetheless, provided, that the elder is of sound mind. If they don't want a particular medication or treatment, they can refuse. They have the right to their own belongings, and that includes their own clothes, having personal mementos, photographs, having their own blankets. Some homes, because of things like bed bugs, can restrict soft furnishings, and they also can say you can't bring too much furniture in. But if you want a chair from your house, you should be able to swap that for the chair at the nursing home. So you have the right to your own belongings, and you have the right to wear your own clothes. There can be no restrictions on visitors. So if any nursing home says these are the visiting hours, that's actually not legal. You have the right to complain without retaliation. And you have the right to choice in food and activities. So even though there's a set menu, they have to every day offer some alternatives. If they're serving fish and you don't like fish, there have to be, a few choices that you can have instead. How to choose a nursing home? Well, is it clean and in good repair? The first thing to do is visit. They should not smell bad, right? So when you say, oh my God, nursing homes smell terrible, they shouldn't. That's not a good sign if they do. Is there adequate staffing? Are the staff overwhelmed and running from person to person? You don't want that. You want people to have a little bit of time to stop and chat with a resident. Are there meaningful activities that people are actually participating in? Sometimes a home will put up a schedule, but you don't see it actually happening, right? So you want to visit and you want to see, are these activities taking place? Are people interested in them? How does the food taste and how does it smell? You want the staff to know residents' names, right? When they don't know residents' names, it means that staff rotate or are temps, and you don't want that. You want to make sure that it's the same person on a floor getting to know the people they take care of, and that they have time to sit and chat with residents rather than only each other. Are there good medical services? Are there rehab services if your elder needs that? And do residents have some freedom, choices, privacy? You don't want to see people restrained. You don't want to see people just lined up in a hallway sitting in wheelchairs, right? You want to have some meaningful interaction between residents and staff. What are some innovations in nursing home care? And some of the activities that you're going to be clicking on after you listen to this lecture talk about some of these innovations, particularly the greenhouse homes, the Eden alternative, they're called. I want you to kind of look at those. Those are really fabulous changes in nursing home care, where they're creating a real home rather than a sterile hospital-like facility. Some nursing homes have memory units, which try to have a more friendly environment, right? We talked about person, environment, fit. When a person has dementia, they're confused, an ordinary environment can be way too challenging. So memory units try to reinforce the person's sense of safety and comfort, and give lots of reminders. Everyone will have pictures on the door rather than a nameplate, that kind of thing. Pet therapy, pets coming into the nursing home. Again, there's good evidence that interacting with a pet lowers blood pressure. And so some facilities have pets visiting. Smaller facilities, right, where everyone kind of knows each other, and it can have more of a homey atmosphere. You'll see some of that in a couple of the videos. These are ways to really take nursing home care and make it more home-like and more humane.